September is Suicide Prevention Awareness Month, and Matt Robinson is the Director of Training at Sweetser. And Matt helps lead their Connect Me to Better Mental Health program that provides free training in mental health awareness throughout Maine. Matt, you are also a published author. I saw the article in the Portland Press Herald. Really well done. And good for you for getting this news out because it's really important.
Very important, and I have a lot of help here at Sweetser helping to get that message out. And I appreciate getting a chance to talk with you this morning.
Did COVID kick things up a notch? I feel like mental health awareness has been highlighted in the past couple of years.
It absolutely has, and the isolation that I think a lot of youth are feeling because of the way we had to do school for a while and the fact that our social connections have been disrupted. I mean, those are things that people rely on and need.
You don't even think about it until it's taken away, and it's never really been taken away in mass like it was.
Absolutely. One of the options that we include was psychological first aid. We have all undergone such a collective trauma with COVID in the last 2 years. We should all be a little bit more informed about how to respond to someone who is experiencing trauma, and that's one of the primary trainings that we're using.
What are some of the signs that we should be looking for, either in ourselves or with loved ones?
It isn't always easy, but some of the more common signs, feeling sad or withdrawn, for long periods, I don't mean a day or two. Drastic changes in moods and behaviors, intense worries that prevent people from doing their regular activities. 3 of the things that you really want to be looking for.
How do people get access to educate themselves?
For the trainings we are running, Sweetser.org/training, there is a series of links that you can use. We're working with a middle school, and they really need some professional development weekly in smaller chunks to fit in with their professional development calendar. It's different ways that people can access it. I want to work with people to make it work for the groups that they have.
It was shocking, the statistic that I read. 270 lives were lost to suicide. 52,000 adults had thoughts of suicide in the last year. And 223,000 adults in Maine have a mental health condition.
Those numbers are staggering, aren't they?
They are.
Nationwide, we see depression and anxiety in about 1 out of 9 youth. In Maine right now, it's 1 out of 6.
Ooh.
And so that's why we're really motivated to try to work with people who work with youth so that they know what the signs are and so that they have some go-to steps so that they feel comfortable making some recommendations and having some conversations.
Are there crisis lines or phone numbers or websites that people should have in their back pocket?
Please, by all means. The main crisis line, 1-888-568-1112. National suicide prevention line, that is 1-800-273-TALK-8255. And one that people may not be as aware of as those 2 crisis lines is an intentional peer support warm line. Peers, mental challenges in the past, and they are trained to listen and to talk with people. That's 24/7, 866-771-9276.
Matt, thank you so much for sharing this information. And of course, all the information is available at Sweetser.org. We appreciate this. We hope that just, awareness that there is help out there and resources, and especially, so many in Maine. And thank you for leading that. Suicide Prevention Awareness Month. Some tools are available in Maine. Please take advantage of them. Matt, have a great one.
It's my pleasure to talk with you this morning. Thank you.